for your testimony. Dr. Marcus, let me start with you. Last week, the CDC released a study in which the most mentioned conclusion was that it is not safe to open up middle seats on airplanes. Are you generally aware of the study's methodology and its conclusions?
Yes, I am. Thank you for the question, Senator Cruz. I am aware.
I'm troubled by the CDC's decision to release the study's conclusions in the manner that they did. Not only was the data from 2017, but it didn't properly simulate an airplane environment. For example, as opposed to the Transcom study, this study used spray bottles that were 20,000 times more powerful than a human cough. The study also didn't consider the hospital-grade ventilation on airplanes, revamped boarding procedures, wearing masks, or the disinfecting of the cabin. Most importantly, the data was collected in a scenario intended to study the importability of a virus. If a person was flying to the US from another country, would they introduce the virus to the US? Which is a different question than how transmissible COVID-19 is on an airplane with and without empty middle seats. In your professional opinion, based on the research you've done on COVID transmission on airplanes, do you believe leaving the middle seat open on flights measurably reduces COVID transmission on an airplane? And do you believe the study that the CDC pushed out last week can responsibly be used as a basis for guidance to airlines and the flying public on the risk of COVID transmission on a plane?
Well, thank you, Senator Cruz, for the question. And let me say my extraordinary thanks for the extraordinary work that's been done by the CDC through this public health crisis and the complexity of leading through this crisis. Yes, I have looked at that study, and our team has analyzed that study. What I would say of that specific study is that it was an experiment. It didn't look at all of the variables that need to be considered. And as such, I would review it in simply that manner. I don't believe that that particular experiment can inform public policy. I don't think it can inform airline procedures and protocols. And so therefore, it can be seen as an experiment without policy implications. What we found in our research is that the combination of non-pharmaceutical intervention, it's the many things together at the same time, do greatly reduce the risk of air travel, and in particular, provides a safe opportunity for people, given the ventilation, given the wearing of masks, given the disinfection on the planes, given the individual and personal hygiene attention, that does allow for that middle seat to be occupied according to the analyses of the ventilation system and the analyses of the overall aircraft that was done by our researchers at Harvard University.
Thank you, Dr. Marcus. That is helpful. I want to turn to Mr. Callio and Ms. Nelson. Thank you both for your testimony. I've spoken to both of you over the course of the past year about the challenges and the extraordinary challenges to aviation, and I know that all of us share a desire to safely return to normal and robust travel. In your judgment, what more can and should the government do to support the industry's full recovery? Mr. Callio, I think you're unmuted.
Okay. Well, there's a couple of things, Senator. First of all, thank you for all your help. Again, we've had many opportunities to talk. What the federal government can do, we do think it should maintain the mask mandate. It has helped considerably on airplanes and in airports. The other thing that you can do is work with us and the administration to create this roadmap to recovery on an international basis. If we don't, a lot of international travel is business travel, so they intersect. If we can't get those back up, profitability is going to be a long way off. Other countries are getting ahead of us now, creating roadmaps for what it will take if I want to travel to the UK, to Iceland, Croatia, take your pick in these countries, and so I can fly there. In the end, if we don't start doing this and take a leadership role like we have on vaccinations, we're going to fall behind and it becomes a competitive disadvantage for the U.S. economy. So that would be a key one to look at.
The leadership is key, as Mr. Callio said. and the leadership also in messaging. So a plan, an international plan with other countries, the vaccination plan, and continuing these mask mandates and making that very clear to the public. Our union has a program right now where we are distributing stickers as flight attendants are vaccinated. It says, I'm vaccinated. And then we say, get vaxxed, wear a mask, and come fly with us. So we would love it if we could have this messaging coming from all of our leadership as well, and in the planning, as Mr. Callio was describing. And we are ready to take part in that planning as well.
Okay, final question that I wanted to raise, again, both with Mr. Callio and Ms. Nelson. There's been a lot of discussion about vaccine passports, and Ms. Nelson, you previously said that vaccine passports would be a mistake for a variety of reasons, including equity concerns. I share those concerns along with many privacy and practicality concerns. I also think such a requirement would depress air travel and potentially backfire, similar to a domestic testing requirement. Mr. Callio and Ms. Nelson, can each of you comment on the potential development of a vaccine passport and what impact you think it would have on the aviation industry?
A vaccine passport, if not mandatory, could be a tool that could be helpful to regain confidence in air travel. But it must be temporary. It must be focused on COVID-19. It must be voluntary. And we just need to make sure that this is not a mandatory program that keeps certain people from being able to access air travel.
Yes, Senator, we appreciate the question. We support a digital health certificate, so it's uniform, and I can flash up on my iPhone and show some country that has a requirement that I have been either vaccinated or tested of my own accord, and that this, like Sarah said, this needs to be a voluntary program. It needs to be time limited, but for someone who travels a lot, like I do, it could be a great convenience and ease my way of travel and provide countries that are requiring these things an easier way to make sure that the information is verifiable. It also keeps my health information in my own hands.
Okay. Thank you very much.
Thank you, Senator Cruz. Senator Wicker?